Hey everyone, welcome to the Kirkpatrick Podcast. It is Vanessa, and I've got a very, very special group of guests with us today. We've got Pamela Heisler and Cassy Miller from the Oregon Child Abuse Solutions Group. They won an award at this year's Kirkpatrick Summit during our Platinum celebration. For those of you that were not there, this was the award that got me choked up and crying. So thank you all for ruining my makeup a little bit at the Platinum celebration. But it was really important for us to bring you all on the podcast because I wanted to share more about this work and the importance of the work that you do. So before I get to their bios, I wanted to share a little bit of like background and some thoughts behind all of this. So, you know, so often I'll own this. I will say, you know, we're not creating life or death solutions over here, right? Like we're not dealing with life or death. Because my purview typically with the customers I've worked with in the past and the work that I've done, well, with the exception now I'm thinking of one organization I worked with, really wasn't life or death. It was, you know, management solutions and things like that, sales training. But when we think about the work of organizations such as the Oregon Child Abuse Solutions or our Department of Defense and things like that, training is critical. And so often we'll share things and say, well, training isn't as important. But there are, in particular, certain training events that are absolutely crucial to get right. The example provided to me this morning was, well, you wouldn't want your pilot to never practice an emergency landing and just do it on the job and figure it out. And I was like, you know, you are right on that one. I didn't think of that. And so, you know, we think about the work that we do as learning professionals. I think especially sometimes in today's climate with the AI of it all and with changes and with organizational restructuring, we think of that our work doesn't matter like it used to, but know that it still does. And these two amazing women are proof positive of that. So I'm going to go ahead and start off with their bio so you can get to know them a little bit better. Pamela Heisler has 20 years of experience in the nonprofit and government sectors and is committed to using her time and talents towards healing, wellness, and community among children and families impacted by trauma. She holds a master's of public administration, specializing in nonprofit management from Portland State University and associates in project management from Willamette University. Pamela has earned 3 Kirkpatrick Model evaluation certifications, our strategic evaluation planning certification, bronze and silver. Her career has centered on children and families and the policies and systems that touch their lives, spending time at Children First for Oregon Department of Justice, the Children's Trust Fund, the Oregon Department of Human Services, and Prevent Child Abuse Oregon. At Oregon Child Abuse Solutions, the state chapter of Children's Advocacy Centers, she manages statewide MDT training, a community of practice for family advocates, and manages data and evaluation projects, including a statewide CAC census. Cassy Miller has over 24 years of experience working in the criminal justice field and has spent the last 16 years dedicated to child advocacy and intervention. Cassy served as an intake coordinator and lead family support specialist, and then as an executive director of a rural Oregon Children's Advocacy Center, CAC. In her role as Director of Executive Leadership and Forensic Interviewer Programs with Oregon Child Abuse Solutions, the Oregon chapter of CACs, she has dedicated her time to supporting CAC executive directors and forensic interviewers in their roles through the provision of training, technical assistance, and communities of practice. Cassy has successfully launched several projects, including mentoring and onboarding programs, 2 of my favorite things, produced a legal summit for executive leaders, developed a strong technical assistance program, expanded the executive leadership community of practice, and established the first community of practice for forensic interviewers in Oregon. Cassy holds a BS in Human Resource Management and is a graduate student, studying for her master's in Human Resource Management, and has earned 3 Kirkpatrick Model evaluation certificates as well, the Strategic Evaluation Planning, Bronze, and Silver, as well as certificates in consulting, change, coaching, and change management. So today we're going to talk a lot about how they went from strategy to impact, and talk about this award-winning blended evaluation plan. So before we kick off, I know I did a lot of talking, probably about a good 5 minutes. So sorry, everyone. It was just kismet, the timing this morning, the conversation I had this morning, and our recording of this podcast. Anything that you both want to share in any of the highlights, and tell us a little bit more about yourselves and the work that you're doing.
Let me go first, Cassy. Yeah, so I'm Pamela Heisler. Been on the team here at Oregon Child Abuse Solutions for just over 3 years. And as you read, my whole history, if it has children in the name of the organization, I've probably worked there or I'll be there soon. This has been my lifelong passion to support kids and families. So right now I get to do it at OCAS and really enjoy my work.
Amazing.
And I've been with Oregon Child Abuse Solutions for about 3.5 years. And as you mentioned in my bio, prior to that, a lot of work in Children's Advocacy Center here in Oregon. And prior to that, my background is actually in law enforcement, serving victims of crime and domestic violence, sexual assault, and some cases of child abuse as well.
Amazing. So how did you get to know the Kirkpatrick model and this 4-level evaluation approach?
So I'll jump in there. So our former executive director was really big on program evaluation, and she had wanted all of the staff trained in robust forms of evaluation, utilizing some proven methods. And so she asked each of us to sign up and attend the Bronze certification program. And I think her intention really was us continuing all the way through Gold. But prior to this, Pamela and I discussed this, and neither of us had actually heard of Kirkpatrick. And so it was just a brand new introduction. But following the Bronze and Strategic Evaluation Planning courses, we wanted Silver. We saw the true value of the Kirkpatrick model. And as a team, we selected the Oregon Child Forensic Interview Training, or as we call it, OC Fit, as the project that we wanted to be working together on during Silver. And that began a year-long journey of evaluating the program.
Wow. Can you tell me a little bit more about what a forensic interviewer does, why you chose that specific program? And we'll start there.
Sure. I can provide kind of in a nutshell. A forensic interviewer is an individual that is trained to work in children's advocacy centers, conducting forensic evaluations of children that have experienced some form of maltreatment. That could be abuse, it could be neglect. And through these really comprehensive interviews that they're conducting, it's done in a developmentally appropriate manner, in a child-friendly environment. And the goal really is to mitigate trauma that kids, experience, and the number of interviews that they're going through, and bring all of the MDT partners together. Instead of a child having to go to, their first disclosure, maybe at school, and then they have to speak with a law enforcement officer that responds, and then a detective, and so on and so forth, a medical provider. All of this is provided at a children's advocacy center, so the child can tell their story. The goal is one time without having to be interviewed over and over and over.
Yeah, I could just imagine how traumatic that is for any of us, anyone having to repeat and relive your trauma, but especially children who are, there's just so many extra factors there. So what was your level 4 goal or results from the program?
Yeah, I mean, I think got to go back to my notes on that. It was it was really around our kids safer. Is the training program impacting the field? And we have a whole list of indicators of what that impact could look like.
Yeah.
Like, are the interviews holding up in court? Are prosecutors convicting more criminals and getting those criminals off the streets so they can abuse more children? Are children being saved the trauma of this duplicative interviewing with the folks who are intervening? Are children getting these trauma-informed, developmentally appropriate interviews no matter where they live in the state? So we had a lot of questions about impact of this one training program going in. I don't know, Cassie, if there's more that you have on that.
No, I think that was really the heart of it. It was really trying to understand, what the experience was like for children in the field as well as their families. And,
Mm.
I think later on we can talk a little bit about some of the findings that we had around the data and the impact based on this evaluation.
Um, so I want to highlight what you both just said about the level 4. What was the result, right? Like, what were you really looking to see? I think for so many that may know Kirkpatrick in some way, shape, or form will say their level 4 result is, is a training effective or something like that, right? And really focus on the training. But what you both said was, are children safer, right? And that really is what leads up to the mission of your organization. It's not necessarily that specific training is, part of that mission, but it's, are children safer? How is this training supporting that goal of safety for children? And that's a really important distinction. So I'm glad that the knowledge from bronze and silver is being retained. I love it. We're doing my own level 3 and 4 evaluation in real time. Now, you both work for the organization. How long have you been there, and how long have you've all been working together? And was there more to your group that participated through the program, or is it just the both of you?
Yeah, so as Pamela had mentioned, she's been here just over 3 years. I've been here about 3.5, and so we've worked together that entire time. There was another partner with us, Kat Hendricks, who participated in this project as well. And
Nice.
Unfortunately, she's not here with us today. She's actually leading a CASA network in Oregon right now.
Amazing.
So yeah.
Good for her.
And Kat had been here prior to Pamela and I joining Oregon Child Abuse Solutions. And I want to say she had been here about a year or two prior to us joining.
Can I go off script like I normally do? I would just love to know and hear your experience of going through as your own small cohort, and what that was like, learning the content together and going through as a group, as opposed to maybe going through individually and trying to do all of this on your own.
Oh, yeah. I mean, it was big for us. I think we all took bronze on our own at different times because, like, just when we came into the organization, when we could schedule it. So bronze, we were on our own, and we each picked our own project, or we were on a team and did their project. That's how it was set up when we went through. And so we all like carved out time. Like, we're going to look at all of our calendars now. We're going to do silver together, pick it, block out that time because we just felt like it was really important to do that next level together. And I don't know if Cassie has any more to say, but it was really helpful. We could, question things, vet things afterwards, immediately pull it into our project.
Yeah.
Yeah, it was pretty amazing to go through as a team.
Yeah, and just to add to that, I think, trying to do this on an individual level, not that it couldn't be done, it's just that it would have been just overwhelming in some ways because the depth of the evaluation that we were looking at doing really benefited from that team response. We were able to, divvy up focus groups and interviews and really dive into the survey and question and really discuss the data that we were seeing and make sure that we were all understanding everything, in the same way.
Oh yeah, absolutely. And I think too, we can sometimes, when we're doing our own analysis, put our own biases on how we're interpreting data. So having that conversation to say, I'm reading it like this. Am I off track, on track? So it's nice to have that sounding board. So let's dive back into the, I love the name of it, OC Fit. Super easy to remember and say, so thank you. So what project methodology did you use, and how did you go about building what baseline looked like for OC Fit?
Yeah.
So
Do you want to take that one?
Yeah, it was a lot. I think our first big part of the project was a more longer term look at who had participated in the program in the last 2 years. So we developed this whole evaluation, sent it out to, gosh, how many people were? I don't think I have in my notes. Do you remember, Cassy? It was
There were hundreds.
Wow.
Yeah, hundreds of past participants to get their, how are you using this information now? How has it shown up in your work? What was the impact now, 2 years later, 1 year later, and what would you change? Or it was pretty expansive, and it went to anyone who had participated. So that was not just forensic interviewers at CACs, but also law enforcement partners and child welfare partners, because they also take the program. So we were able to reach out to them. We have daily evaluations every day of the entire week of OC Fit that they do each day. They have a full evaluation at the end of the whole week of the training. Then we did focus groups with each of the professional groups who go through OC Fit, so law enforcement, child welfare, forensic interviewers. And then we did interviews with people who were a former executive director before OC Fit existed. So I think OC Fit is almost 15 years old now. But before that, forensic interviewers going to different trainings around the country and all coming back and doing
Their own
thing. There was no standard Oregon training that everyone was expected to do. So we met with people, current and former executive directors and prosecutors who've been in the field that long, and said, what was it like before OC Fit? What have you seen since? And those were some of the most powerful interviews and follow-up that we had, actually, to hear their stories of the before and after. And then we also compared all of that to every CAC offers a survey to families when they're leaving the center after they've gone through their full evaluation and assessment. And they offer it to the kids if the kids are old enough to do it, and then to the caregiver. And so we have a whole data system of the centers of information directly from the youth and families, and we pulled that in as well to kind of look at the full picture of the impact of the interviews and the CAC experience. So it was a lot of pieces to pull in.
The other thing that we also had for participants was the pre and post OC Fit knowledge test. So we're gauging the learning that was taking part throughout that week as well.
So that sounds like a lot of data and a lot of different sources and a lot of qualitative data that you also had to sift through to find themes and organize. What did you all utilize to help you with some of that sorting of the data to be able to understand it?
Well, we gathered in Cassy's living room. We are a virtual team. We do not have an office. So we spent a lot of time in Cassy's living room with the results and the actual, the transcripts from the interviews up on her big TV. And we would go through and line by line, answer by answer.
This was pre-AI, everybody, just so you know.
A lot of it.
Yeah, that's wow. I can only imagine how many interviews and transcripts and data that you had to go through to do that. if only ChatGPT had come, or these AI tools had come a little bit earlier.
I know. We were so like
Because I think
months
you
later,
all are
and we
right
would have been
there.
able to use ChatGPT.
Yeah, I've done, but and even that though, right? A story that I share often, like on the podcast and with others, is I've done qualitative analysis with not ChatGPT, but with other platforms, and you have to still read what the output is, and keep the human in there, because just like we have our own biases of how we're interpreting the data, ChatGPT and these AI tools also have that. So there definitely needs to be checks and balances.
Right.
For sure.
Absolutely.
What were some of the before we get to like the impacts and the like how you're starting to see things shift, what were some of the critical behaviors that you all defined for a forensic interviewer?
I'm trying to think back to that specific, I think it was really around trying to understand, when they were going into these interviews, and, how they were approaching these interviews versus how they were approaching them prior to us. Just to provide a little bit of background, in some CACs, they can do kind of an in-house training where they can attend a national training and begin working with families before they're able to be accepted into OC Fit. That's not true across all of our CACs, but it is true for some of our CACs. And then, once they have received their OC Fit training, looking at kind of what they were doing prior to that versus what they were doing after. And the most important things were how questions were being asked, the environment in which, the interviewer is conducting those sessions, just to ensure that we're following an open narrative, non-leading format.
Oh yeah, that's absolutely crucial. So tell us a little bit about some of your findings. What did you all find, and then how have I'm assuming you found, not just impact and how, the great work that's being done, but also areas of opportunity, and how are you utilizing some of those areas of opportunity post impact study?
We found some pretty incredible things, and I will invite Pamela also to jump in, just to talk about some of the interesting things that we found that kind of surprised us a little bit. Is we had a 51% response rate to what we refer to as our longitudinal survey. So that's that really, over 2-year period of folks attending.
Wow.
And out of 91% of our forensic interviewers that responded to the survey felt that their workload was manageable, which shocked us actually,
Wow.
because we really went in assuming that workloads were too high, but that just simply wasn't supported by the data. The second thing rather that impacted the data collection was that our field responders, such as law enforcement and child welfare, kept indicating that they were forensic interviewers in the survey. So when they would answer questions that were intended, for forensic interviewers only, it caused some issues with, us being able to analyze that information. So what happened is it forced us really to go back to each response individually, as Pamela was kind of talking about, digging through in the living room on the big screen, and hand sort them out by profession. So this helped us see a couple things. One, it was an opportunity for the next time that we do an intense evaluation like this to really make sure that we're using separate surveys depending on profession. And it also kind of highlighted some confusion in the field about who is or who is not a forensic interviewer. So, for example, there's a common misconception that once you go through OC Fit, you are then a certified forensic interviewer, and that's simply not the case. It's not a certification program. And a forensic interview is not an interview that's conducted in the field. It is one that is conducted in a children's advocacy center. And so that was a really important distinction that we want to make sure that we're going back to the field. And we've actually put a lot of effort in the last, I'd say, over a year on really educating the field around this is what a forensic interviewer is and where they conduct those interviews. And this is what a field interview is. And we're making headway. So those were some of the surprising data findings. Pamela, if you want to jump in, we also had some really amazing data that popped up for us.
Yeah, I was just going to add to that. If for folks who don't know anything about forensic interviews, so the key component here is that they are recorded, so that later on the jury could see the actual recording of the child at the time that they were making their disclosure, can see mannerisms impact, because here trial might not be for a year, 2 years, 3 years down the road, and children change and grow. And so that interview being recorded is essential. So when we have child welfare and law enforcement going out in the field saying they're a forensic interviewer and doing it, outside the house, standing by the police car and asking really detailed questions and getting into the weeds, it can impact the entire case and kind of taint the process so that maybe the forensic interview can't be done later, or maybe the defense attorneys can get the case thrown out because there were too many interviews done. So it gets hairy when those interviews are happening in the field. So that was a finding we found from this. It was like, oh, we've got to address this immediately.
Yeah. And I think as a state, we're doing a really good job with that, in terms of making sure that we are training our responders in a way that, we actually see we have another training called Collaborative Child Abuse Response Training, and then OC Fit, of course. And when folks attend these trainings, field responders are attending these trainings, we're seeing an increase in some cases of referrals to the CAC. So they're recognizing in the field, I'm going to do this very brief interview, if you will, to collect what I absolutely have to do to ensure safety, and then I'm going to get it to a forensic interviewer.
Yeah.
So good things are happening.
What a powerful thing to find, because it, to your point, Pamela, like it could completely affect the outcome of a case and put a child in harm's way, right? And it's not training related. It's nothing to do about the work of OC Fit and that work. It really has to do more around the clarification of job roles and job responsibilities around the process. And so, I'll make the assumption that you're not training people on what their role is. It's more of a communication messaging and really clarifying more, marketing, if you will, right, of understanding roles and responsibilities. So it's not now an intervention to correct that. That is, training isn't going to solve it. It's that communication and clarification can solve that. And I think the other thing that you said, it was Cassy who said it, that was powerful, was when you were talking about people filling out the form improperly and identifying as forensic interviewer when they were not. You said, well, we assumed everyone knew what their role was in the process, right? And I think, again, when we talk about evaluation, learning people's behavior and how we all make assumptions. And so it's really important and that clouds your data. So it's, if you didn't catch that, and say, wait, there's something wrong here, and then do the work to separate those things, it may have clouded the way that your recommendations would have panned out in the end. So human in the loop always.
Absolutely.
Okay, so you've analyzed this data. You've started to communicate better about roles and responsibilities with the program. What else have you done with some of this data, and what's next for OC Fit?
Yeah. Before we jump into that, I wanted to loop back to your impacts question because we didn't even fully get to that. So we were actually really blown away when we compiled all of this. So we found that it created, and this is from all the interviews and focus group information, but it actually, OC Fit has created statewide consistency in interviews and increased the objectivity of the interviews. And that is all very important for going through the court process if there are proceedings happening. Reduced cost and barriers to forensic interviewers getting their training and being ready to work quickly in their local CAC. Improved investigation, prosecution, and judicial handling of cases, because now the prosecutor can really count on those recorded, fact-finding, neutral interviews to go through a case and be strong representation of what the child went through. Improved collaboration among partners who intervene when there's child abuse. So law enforcement, child welfare, medical providers, CAC, mental health professionals, school professionals. OC Fit has helped bring them all together better around children and in their experience, and improved trust in the field among those partners, which I feel like if that trust is not there, you're not going to have a great case. Yeah. You're not going to get through that swiftly and efficiently. And then increased credibility of the forensic interviewers in trials. So RFIs are constantly called into trials now, and can be great witnesses and fact experts on cases because of this trust and reputation that they've built now through the OC Fit training over the last decade. So we kind of walked away like, woo, this is good. No, Cassy,
did you have a party? Did you celebrate? A little high five celebration?
Yeah.
Yeah, we always know there's more work to be done. You know, it doesn't end there. We immediately started looking at, we're like, yay, there's some great things happening, and there's so much more we need to do and so much more we need to understand, and stories that need to be shared. So that's just kind of how Pamela and I work.
Don't worry, me too. I know I celebrate for maybe 1 second when I find out good news, and then I'm like, all right, next thing.
Yep. Work to do. That's right.
Are other, totally just it popped in my head, are other states or organizations looking at your training and looking to see how they could maybe use that as a template to standardize as like the standard or a standard for forensic interviewers to then adjust for their own state or for their own organization?
That's a really great question. So OC Fit is an accredited training program through the National Children's Alliance. So across the nation, you have a number of forensic interviewing programs. Some are state-based programs like OC Fit. Some are national models that a state adopts. And so there are so many different training programs out there. And we have had conversations about what would it look like if we opened OC Fit up to other states, maybe some of our neighboring states that are working with a national model. And it's something that we continue to kind of explore. There's, some complexities there that we would have to work through. This is very Oregon focused, following Oregon law. OC Fit follows something called the Oregon Child Forensic Interviewing Guidelines, which is a set of guidelines drafted by subject matter experts and approved by the Department of Justice as kind of a framework for conducting a forensic interview in Oregon. And I think that is something that is really unique to the state. I can't speak to it being the only state that has its own set of written forensic interview guidelines, but I think that we're one of very few, if not the only one.
Amazing. So, how did you keep your stakeholders in the loop and involved throughout the process? And then to continue some of this work that y'all are doing now to continuously improve?
Yes, that's a fantastic question. So one of the first things that we did was generate a really robust report for the Oregon Department of Justice, as well as our regional children's advocacy centers. And just to kind of make a little bit of sense, in Oregon, we are unique that we have state-based regional CACs. There's 5 regions in Oregon, and those regional CACs receive grant funding from the Oregon Department of Justice to provide training and technical support and some expertise, peer reviews, things like that to all 24 CACs in the state. And so we work with them really hand in hand on a lot of projects. And in fact, it's the trainers of OC Fit that are from those regional centers. And so we crafted the really robust report as well as an executive summary to make a little bit lighter reading, if you will, for the Oregon Department of Justice. But prior to that, we provided quarterly updates to the Oregon DOJ, as well as the Children's Justice Act task force that oversees the funding we receive for this work. We held a formal presentation with that same CJA task force on the Kirkpatrick model, actually, so they could better understand the work that we were engaging in. And then we later presented our findings to the task force and provided that summary report. And so those were some of the things that we were doing to ensure that, our stakeholders were really involved in this. We kept our training team, the subject matter experts, up to date on what we were learning, any kind of changes that we might want to make to OC Fit. So it was a really well-rounded response in terms of keeping our stakeholders, really up to date on what was going on. I think it was really fun, too, especially with, instead of just going and presenting this data, really, holding that presentation for them on Kirkpatrick so they could understand really the importance and how the process worked and how in-depth of an evaluation that we were doing.
Yeah.
Is there anything to add to that, Pamela?
Oh, I was just going to say, I think partly we had to do that because there was like, when are you going to be done? When is this going to be ready? And so it's like, let's do a preliminary presentation on what we're doing to help them understand this is going to take a little while, but we will get it done, and this is why. And then later come back with the recommendations and the results. So I think there was an interim step in there to.
But that interim step, but you bought buy-in too, right? In the process, and that and understanding that this is not an overnight sort of situation or process, right? If you want to do it right, you really have to comb through a lot of data to identify the success stories and where we have opportunities and what's truly happening. And I think, where we as a community will have our own biases. We just assume everybody knows the Kirkpatrick model. It's 4 levels. Doesn't everybody know what this means? The words are so simple. But knowing that often everyone comes to the table and different ways, from different places. So we have to take a moment, take a beat, take a step back, and say, let's all make sure that we're speaking the same language. And so you understand the methodology and the framework and the process we're going to go on. And then, present those final results and those, and get those findings over to you. And, I think, in the absence of communication, people make up stories, or they fill the stories themselves, they fill in the silence. And so sometimes when, we are feeling like we're getting pressure from our stakeholders to deliver, I say, that's maybe the case. And let's pause and say, did I properly set up my stakeholders to know this is the process I'm going down, this is how long it's going to take, and then do some check-ins along the way, so they know the work is getting done, and just so they get little like teasers, like trailers, like a good movie, if you will. So amazing. What are you most proud of throughout this process of being able to accomplish?
I think we absolutely love that question because we had some proud moments, but we are most proud of the listening sessions and the interviews that we did to gather the whole OC Fit story and the impact beyond those who are taking the training, such as the prosecution and the children and families that they serve. So this was a really significant body of work, and we're excited to share, what we have learned with our stakeholders. So really just connecting with the individuals out there that went through the training, who are in the trenches, who are doing the work, was absolutely our proudest, moment throughout this process.
Pamela, same for you or anything else?
Yeah, I mean, I think a proud moment was just the lift of getting through all the information and pulling it together too, because it took us over a year to finally get through all of this, pull it together, get it in paper, the highlights, pull out the recommendations. And I feel like that felt like just a highlight for me of, wow, we did this, we got through it. And we have something really powerful to show for it, and really great next steps on how we can improve even more what's happening for kids in the forensic interview.
Amazing. So what's next? How are you going to continue growth? What are we doing now?
So we had a lot of recommendations that came out of this whole evaluation process that we worked on. And one of them was to launch a forensic interviewer community of practice, as well as a statewide peer review for forensic interviewers. And we have successfully launched both of those in 2024.
Yay.
So we're very excited for that community and for those networking and peer review opportunities. We're also exploring what a refresher course might look like, and especially around additional practice sessions. As you are aware, OC Fit includes, recorded practice interviews where there's role playing and they have to work through the forensic interview process. So we might add some additional sessions. And we intend to launch another major evaluation of OC Fit covering a 5-year period in 2027. So we're looking to do this again. The exciting part of that is we learned so much through this process that we are tracking and working and doing all of the things during that period. So when it comes to the overall evaluation, it will be not feel like such a big lift. We're also launching comprehensive evaluations of some of our other trainings. And this is kind of Pamela's baby, so I can let her talk about that, but she's looking to train all child welfare service providers in Oregon with her training collaborative child abuse response training. So
I'm in the process of developing that comprehensive evaluation plan for our other kind of signature training, which is more broad and targeted at MDT partners, that child welfare, law enforcement, schools, mental health, parole and probation, anybody who at all might engage in a case where there's suspected child abuse.
Wow.
And we actually are about to enter into a partnership with our state child welfare to train all of their employees over like an 18-month process. So hundreds of child welfare workers across the state. So I want to make sure as we do that and build that out, that I've got my comprehensive evaluation plan geared up to go through that process too. So I'm excited to have that in place and then come out of this in 2 years with some great information on impact.
Amazing. Well, I'm excited to hear about that. Hopefully by 2027, our technology will be done. So you can use that for your evaluation. That is goal. I want to thank you both so much from the bottom of my heart for the work that you do. As you know, everyone knows I've got 2 small children. And so to know that there's people like you that are doing this work to ensure that all children are safe, is just amazing. So thank you. And so with that, friends, I'm going to go before I ruin my makeup again. Thanks, guys. Appreciate your time today. Make sure that you like, share, and subscribe to this podcast. People need to know that this work matters and that you can do really amazing things and show your level for result and impact. I'll catch you next time, friends. Thank you both.
Thank you.
Awesome. Well, thank you both so much. I will let you know once this is going to go live and, share all of the other good stuff with you all. But I do appreciate your time today.